Hi, Dr. Frank Johnson from Sport Medicine Ultrasound Canada. I'm going to show you how to scan the posterior elbow joint. So, we normally have our patients supine with the arm across the body like this. For purposes of training, what we're going to do is we're going to get our skeleton model into what is an unnatural internal rotation, just so the camera can pick up the angles well. So, the orientation of the probe is going to be long on the humerus. The landmark is going to be the bony tip of the olecranon and the humerus here. Now, the movements are going to be some slight micro movements towards the ulnar side and the radial side of the arm, and then some slight angulations. So you make sure you have a bright ulna and a bright humerus. The area of interest is going to be in the olecranon fossa. There's a fat pad that communicates with the elbow joint. So that's what we see on ultrasound, and that's how you scan the posterior elbow joint. Going to show you how to inject the elbow joint without going through the radial head humeral interval, which spares that cartilage. You can go into it from the posterior approach into the olecranon fossa. Your patient position is supine with the affected elbow flexed 90 degrees, and I'm going to be treating the near elbow. My landmark is going to be the olecranon. I'll get that on the right-hand side of the screen now. And my orientation is going to be long on the triceps tendon, which we can see annotated by the yellow arrow here. To do the injection, I'm going to come out of plane and I'm going to touch the needle into the very base of the olecranon fossa. The angle of entry is going to be just like this. There's a slight modification if I'm injecting a more expensive or more delicate product like hyaluronic acid or PRP. When I'm doing that, I really want to make sure I get my needle tip touching articular cartilage to be sure I'm getting into the joint space, in which case I slide a little distal, flex the elbow just a touch more so I can see the articular cartilage of the humerus in view, right where the tip of the yellow arrow is now. And I like to come in plane along this angle and touch my needle tip to where the yellow arrow is pointing. And that's how I do an elbow joint injection.